Hey there, and welcome back to Shock Doc Medical. I'm your host, Dr. Rod, and today we're diving into a topic that doesn't get nearly enough attention: pediatric hypertension. It's subtle, sneaky, and far too often goes unnoticed, but it can lead to serious heart and kidney problems later on. We're going to break it all down today, especially with insights from an article by Ann Thomas, published on January 15th, 2025. We'll talk about why this issue is underdiagnosed and untreated, and what we really need to be doing to make sure our kids' futures are healthier. Now, let me paint you a picture. High blood pressure in kids. It's not something we often think about, right? We're so used to associating high blood pressure with adults, especially those over 40. But here's the thing. Kids can have it too. And the scariest part? It's often missed. In fact, while nearly half of adults with high blood pressure don't even know they have it, things are even worse when it comes to kids. That's what we're talking about today. Why pediatric hypertension is so under the radar and what we can do about it. So here's a startling fact from pediatric cardiologist Dr. Abbas H. Zaidi. Fewer than 25% of kids with hypertension are actually diagnosed. Let that sink in for a second. And of the ones who are diagnosed, about half don't even get any treatment. This is a major gap in care for a condition that affects 3 to 5% of kids, and when untreated, it can lead to serious cardiovascular and kidney problems as they grow older. Dr. Zaidi and his team wanted to understand why this is happening. They interviewed parents and pediatric providers, doctors, nurses, you name it, across Delaware and Pennsylvania. And they found something surprising. Both parents and doctors often don't take high blood pressure in kids seriously. A lot of people assume it's just a mistaken measurement or a case of white coat hypertension, that temporary spike you get when you're at the doctor's office. It's understandable. Parents know how dangerous high blood pressure can be for adults, but when it comes to their kids, there's hesitation. They worry about the side effects of medication and whether it's even necessary to start treatment so young. And that doubt between parents and healthcare providers, it creates a huge barrier. We really need to overcome that because ignoring this problem just isn't an option. Let's talk about how we can fix this. Dr. Joseph Flynn, a leading expert in pediatric hypertension, says the key is accurate blood pressure measurement. Sounds simple, right? But think about it. Using the right cuff size, having the child seated calmly, taking multiple readings. That's how you get an accurate picture. Dr. Flynn makes a great point. If we did this every time, we'd catch these cases way earlier. And honestly, it's those small things that make a huge difference. But here's the catch. Technology isn't always on our side. Dr. Carolyn Kinsella points out that a lot of electronic health records don't even flag when a kid's blood pressure is high. So, when an elevated reading is found, she doesn't jump to conclusions right away. She checks again at the end of the visit when the child's more relaxed and sometimes even follows up with a school nurse. It's a hassle, sure, but it's worth it. To help rebuild trust in the diagnosis, experts like Dr. Zaidi suggest taking measurements outside the doctor's office, at school, or even at home. Home blood pressure monitors could give a more accurate reading without the stress of the clinic. Another hurdle is the complexity of the current guidelines. Pediatric blood pressure charts are tough to navigate, with variations based on age, height, and sex. Dr. Flynn thinks we could make things easier by simplifying the guidelines, maybe by reducing the number of measurements needed, similar to how adults only need 2 readings for a diagnosis. This would make it a lot easier for doctors to act fast. At the end of the day, detecting and treating high blood pressure in kids early isn't just a medical issue. It's a community effort. By improving how we measure blood pressure, simplifying the guidelines, and listening to both parents and healthcare providers, we can make sure every child gets the care they need to grow up healthy. So thank you for tuning in to this important discussion on pediatric hypertension. If you found this episode helpful, hit that like button, subscribe for more, and share it with others. Together, we can help create a healthier future for our kids.